The first official concept and use of quarantine started in Venice in the late 1300s during a big plague epidemic. And this is before the germ theory, before we knew what pathogens caused diseases. It was quite clear that human mobility, particularly by sea, was moving the bubonic and pneumonic plague around the world through ports. And the Port of Venice set up this system, a formal system of quarantine. Quarantine comes from the Italian and then Latin quarantina, meaning 40 days. They would stay out of port, flying a yellow quarantine flag for 40 days until the epidemic of plague or whatever it would be would burn itself out. The concept of quarantine was used to protect healthy cities from the importation of these threats through commercial travel.
In 1998, President John Adams and Congress created the U.S. Marine Hospital Service. This service established a network of hospitals and quarantine staff along the coast to protect our young country against the spread of disease. Sailors and immigrants arriving from foreign ports were screened for signs of disease. Sick people were isolated and treated, and exposed people were quarantined. Eventually, this network became the U.S. Public Health Service.
The Foreign Quarantine Service began to come into being through regulation and law changes in the Public Health Service Act around 1948. The concept of quarantine, first and foremost, originated in a commercial context. It was about protecting international commerce and the receiving communities from the benefits of that commerce. It wasn't until 1967 that it came to CDC during a great period of mergers and acquisitions.
In 1969, quarantine practice went from ships to spaceships. President Richard Nixon cheers the Apollo 11 astronauts who just returned from the moon. To prevent potential cross-contamination from space, the astronauts spent 21 days quarantined inside a hermetically sealed trailer, as CDC recommended. In January 2017, CDC updated U.S. federal quarantine regulations and published the final rule for control of communicable diseases, interstate and foreign. These rules clarify CDC's authorities in controlling the importation and spread of communicable diseases into the United States and territories, and ensure CDC will seek to use the least restrictive means necessary to prevent the spread of communicable diseases.
One of the challenges, it's both a challenge and a great opportunity, is to align and deal with the balance of protecting public health, protecting American communities, with balancing the civil rights of individuals. That balancing act is very, very challenging. When I told you earlier about the ethics of quarantines in the 14th century through, I would say, the early 20th century, it really focused on the protection of the community at the expense of the victims. The victims were seen as vectors and nothing else, not victims of disease. We had the emergence in the last 50 years of the civil rights movement in the United States, where the rights of individuals and human rights and individual rights and rights of vulnerable populations has come, right up front and center, as it should. But when you think about applying the regulatory responsibility of quarantine, and our division has the largest regulatory responsibility at CDC, you've got to do that in a way that's commensurate with protecting individual rights and civil rights. And it's a challenge which we welcome.